Welcome to Self-Care for Caregivers, a wellness podcast series brought to you by HCA Healthcare. I'm Dr. Frank Drummond, National Medical Director for Behavioral Health Services.
This podcast may not contain all of the information on the covered topic that is important or relevant to you. You should not place undue reliance on the accuracy, fairness, or completeness of the information presented. This content should not be used as a substitute for independent clinical judgment. Anyone with questions or concerns about the covered topic should consult with their healthcare provider. This HCA Healthcare podcast is intended to inform providers on our hospital's medical staffs, our employees, and other interested parties.
Today, we are going to speak on sleep-life balance, and I have the great pleasure of being joined by Dr. Misha Peter, the Medical Director of Methodist Sleep Lab in San Antonio, Texas. Welcome, Dr. Peter, and thank you for joining.
Hi, Dr. Drummond. It's a pleasure to be here.
What I would like to discuss today is a little bit about how to manage sleep as far as self-care, particularly with some of the considerations that caregivers have and some of the limitations around our work and the kind of work that we do. Like to start by asking you, what would be considered the ideal quantity and quality of sleep for like a working adult?
So, that's a great question, right? Because I feel like a lot of times we're all wondering if we're rested enough and, if we're sleeping enough, especially with everything that's been going on. So when we look at actual numbers, the National Sleep Foundation did the 2018 Sleep in America poll. And, one of the big things they found was that a lot of people aren't sleeping enough. And as a result of that poll, one of the other things that came out of it is, again, looking at the amount of sleep that would be considered ideal. And that's anywhere between 7 to 9 hours for a working adult. So when we look at that population, ages, 25 to 64, you need at least 7, if not 9 hours of sleep. And that does tend to vary between people.
Great. And I see a lot of variation in that as well. Some people claim that 6 is fine, 7 to 9. I think one important definition for your self-care or for conversations is when you're getting below that 6 or 7 hour number, looking at sleep deprivation with some obvious consequences, a decrease in concentration, a decrease in mood, some anxiety and irritability, that might be the single explanation, right?
Absolutely. I mean, I think, really when we look at the number of Americans who get less than 7 hours of sleep, it's almost as much as 40%. And really, it's kind of amazing how we always think that the one thing we can get by on is less sleep. Everything else seems to take precedence over sleeping. But when we look at it, we sleep for, a third of our lives. When we sleep better, we probably will, we'll have healthier BMIs. It has so much impact on cardiovascular health and metabolic health, neurological health, that really being able to get those 7 to 9 hours needs to be a priority. And I don't think a lot of us really are proactively thinking of that when we start our day. No one's waking up in the morning and saying, well, I have to be back in bed by 10 p.m. no matter what happens. Most people are saying, let me get through my day and let's make sure that I'm able to do this and that. But we really need to be budgeting time for sleep. I think that should be a priority.
Yeah, I agree. And that's why we're having this talk today. So thinking about it, what are the top 3 sort of positive lifestyle influencers of having quality sleep? What are the top 3 things you can do to contribute to having quality sleep when it is?
So just like we talked about, so being cognizant of the need for sleep, right? So I think, again, knowing that this is a big contributor to health in general, and it's the easiest thing you can do. One of the interesting things is if you ask the average person, what do they consider the biggest contributors to health? One of the things that kind of came up is that most Americans, when they start looking at the things that are important, fitness is way up there, work is way up there, hobbies are way up there, and sleep is a 4th thing. So actually it's the National Sleep Foundation, the 2018 poll. Sleep was the 4th priority as far as Americans are concerned. And I really do think making that, at least pushing it up that list is essential. So being cognizant of the need for sleep is a big thing. The other positive things that we need to be thinking about would be, routine. So again, making sure that you have a routine, because as humans, we thrive on routine. So I think making that part of your lifestyle is important. Avoiding pitfalls like drinking too much alcohol, drinking too much caffeine. I mean, I think these are things that we tend to do, which are considered socially acceptable for the most part. I mean, there's nothing wrong with having a cup of coffee at 2 p.m. or 3 p.m. as far as no one's going to stare at you, right? But at the end of the day, it impacts your sleep quality. It impacts your health. And I think the third thing that I would really stress on is you have to know when to seek help. So if you're snoring, if you're tired, if you find yourself tossing and turning, and I'm sure a lot of people have been doing this, especially with the year we've had, you have to be able to recognize that this is a problem that requires more than, self-medication or just, a self-help video. We really should be directing those people to seek care because it may be indicative of a deeper problem.
Interesting. So to reframe it, the way I'm hearing you is the number one thing is to take your own sleep seriously and
Yes.
make it a priority and
Yes.
adjust your life around the fact that the sleep is such an important part of accomplishing all your other goals.
And that's exactly what I tell my patients. I think it is the easiest thing you can do to become more productive.
It's also easy to ignore the importance of going to sleep or managing a good bedtime, right? Like it's very easy to say, well, I'll just stay up and, do this
Correct.
later or do this task later than prioritize anything else over. Work overlays or even hobbies or socializing. Really important point is to understand that the sleep that you get is one of the biggest drivers for your well-being.
So if you look at us as a society over time, we've actually decreased the average number of sleep hours. So in the 1940s, Americans were sleeping close to 8 hours. And now with, we have plenty of reasons why it happens and we can kind of delve into that. But I think now when we look at the average number of hours that we sleep as a society, it's closer to about 6.8. So it's a little less than 7, which really isn't enough.
Yeah. What would you say, although you mentioned coffee later in the day, some dietary choices, what would you say are the biggest sort of enemies having quality sleep or patterns that you see that you really have to steer patients away from?
So patients and colleagues and family.
Right.
So the big things that I've been accused of harping on this many, many times, but I think I cannot stress enough that as a society, we are so wired, we are so connected, right? So it happens to the best of us. So, after a bad day at work, we are going to be sitting in bed, playing, Angry Birds or Candy Crush or whatever is your game of choice and saying, oh, it's helping me relax. Or you decide that, I'm not tired enough to go to sleep. Now, I think what we forget is that, going to sleep very often, especially if you are not in a set routine, it needs to be an active process. You have to pick up that iPad or you have to pick up that phone and put it away. So it's not going to put itself away. That light is not going to go away. And I think that's the biggest thing that I see is that everyone is guilty of opening Facebook for that last look and then reading something that upsets them and then messes up their sleep, obviously. But so I think being disciplined enough to put away your phone, put away electronic media and saying, it's 10 p.m., it's 10:30 or it's 9 p.m. and this is my time. This is when I need to go to sleep.
I've noticed also that, reading at bedtime can be okay. That's
Correct.
A little more passive and more relaxing and engaging and actually puts you in a different frame of mind if you're reading some fiction or fantasy or something like that. But people have now substituted electronics, either doom scrolling or playing games, as you said, like it's the same as reading, but it's not. These are creative, addicting. By addicting, that means stimulating, not relaxing. So while it is time-consuming, stimulating, and distracting, it's not rest-inducing.
Exactly.
Is what I find. Mm-hmm.
Exactly. And I think, again, when we say reading, we do have to be careful about the media that we use to read, right? So I always tell people, use an old-fashioned book. At the end of the day, nothing like an old-fashioned book. You can turn the pages, absolutely, smell the book if you want to, but picking up your Kindle or your iPad to read the same content. So we're not really talking about, difference in content there. We're talking about the actual instrument that you're using. And that old-fashioned book, and this is really important, does not give off light that hits your eyes. And that light stimulation is what disrupts sleep.
Interesting. So do people ever take your advice?
I have had varying degrees of success, depending on family, colleagues, and patients. I feel like patients are actually the easiest people to convince. Family is the last on the list, and patients are the easiest people to convince because they actually come to you for your opinion. So
right. Yeah, this stuff is addictive. So, I mean, you have to be very cognizant about it.
Yes.
Tell me what you describe or what do you prescribe as far as an ideal sleep environment, like the physical space? Like, how do you tell people to situate their sleep area?
So one thing my husband knows is, and he knows better than to ask after, years of marriage, no TV in the bedroom. It's very, very simple. There's no television. Wow. Absolutely not. And it's one of the first questions I ask people when they come to see me, So when a sleep patient comes to me, one of my first questions is, describe your bedroom. Do you have a television? And more often than not, the answer is yes. Some people will carefully categorize that and say, well, we don't use the TV in the bedroom, which is a great answer. I love hearing that. But again, having a television in the bedroom is again a distraction because really the bedroom should not be used for anything other than sleep and intimacy. It really should not be a place where you eat. It shouldn't be a place where, you're watching a movie or doing anything that disrupts the routine of sleep. So that's one thing.
You're quickly becoming America's least popular doctor.
I know. Let's just edit all of this out. But anyways, so then the other thing, I tell people that at the end of the day, all these ads you see about mattresses and pillows, I mean, yes, to some extent, absolutely. A quality mattress, you want to make sure that you have a good mattress, that you've changed it out, if it's too old and let's say you have something that has springs and things like that, you don't want to be physically uncomfortable, right? When you go to sleep, you want to be comfortable enough to relax. You want to get into bed and psychologically, you are now at this point where you've prepared yourself for bed and you have seen your bed as, okay, this is the place where I'm going in to relax. This is the place where I'm going to fall asleep. So that bed-sleep association, that is vital. We don't want to do anything that breaks that bed-sleep association, which is why I tell people don't use the bed for anything other than sleep and intimacy. So a good mattress, a comfortable pillow, those things are great. Do you want to spend a couple of grand on an expensive mattress? Not really. I mean, ultimately, at the end of the day, it's about just finding whatever works for you. And, that depends on what's cost effective and whatever works for you. Now, it is important that your spine, remember that you're going to be in that position for 7 to 9 hours. So you want to make sure that, the mattress is the right density and things like that so that your spine is, gets the proper support so that you don't wake up with aches and pains and things. Just the usual good bedding. The big things, honestly, is light stimuli in the bedroom. So I always tell people, if you are someone and you kind of will be able to figure out how rested you are after a good night's sleep with no light versus if you have light in the bedroom. So excess light exposure has, without doubt, been known to disrupt circadian rhythm. Depending on when you get that light exposure, that makes a difference. So again, like we talked about, the iPad and the phone, the light that they give off, it's that late night exposure that causes your circadian rhythm to get shifted. So I have patients and for myself as well, blackout curtains over the windows, those kind of things, anything to prevent light from interrupting your ability to go to sleep. Some folks like sleep masks, whatever works for you. But really the goal is to block light and essentially just keep it from interfering with your plan to sleep. Peace and quiet. Really, you have to keep noise to a minimum, right? There are folks who say, I like that ambient noise. And some folks need that white noise in the background, and that's okay. What I don't like is audiobooks that, are kind of stimulating you and things like that. So the goal is to figure out how to get that peaceful, quiet environment Temperature, big one. So you want to make sure that your sleeping environment is cool. Moderation is key here. You don't want it to be too hot. You don't want it to be too cold. But I guess what we kind of describe usually as ideal temperature is around 65, 68 degrees. And, it may seem a little cool, but really when you sleep, your core body temperature falls. So the goal is to kind of match that.
So a lot of the same rules that apply for babies still apply as adults.
Babies are incredibly good about listening to environmental cues and listening to their bodies, right? And then as we grow up, we have all these environmental cues that change. And really it comes down to that. Now, I will tell you that babies need far more sleep than we do,
Right.
as do teenagers and as do kids. But ultimately, if you can get those 7 to 9 hours of quality sleep, I think you're probably far ahead of a lot of people.
I'm going to shift a little bit. How do you talk to people about sleep supplements, over-the-counter things, melatonin, valerian root, maybe even Benadryl, these sort of things that are considered non-medical but are medicine?
So I will tell you that as far as supplements go, I tend to kind of put melatonin and valerian and chamomile and all those things into one basket, and I put Benadryl into one of the naughty baskets on the other side. Benadryl, yes, it's non-prescription and all those things, but ultimately at the end of the day, it is FDA regulated and it is a drug. As far as melatonin goes, so, I think one of the biggest misconceptions about melatonin is that it's a sleeping pill, right? So melatonin is more of a time shifter. So when we look at the role of melatonin and the actual pharmacological effect of melatonin, it's actually produced in the body. So it's produced by the pineal gland. It's produced in relation to light exposure and things like that. So the more light you see, the less melatonin your body produces. Again, going back to the reason why looking at a phone, staring at an electronic screen tends to cause sleep disruption, because the amount of melatonin your body is producing will go down. It'll get suppressed. So when we start using melatonin exogenously, so when we take that melatonin supplement or the gummies or whatever is your choice, one of the things we have to remember is that if you use the supplement in conjunction with good sleep hygiene, it's a very different effect from if you do other things that are not optimal. So if you're using your screens and not sticking to a routine and saying, well, let me just take melatonin, I'll be fine, that's a very different effect. The other things I do tell people is that, remember, melatonin and valerian, these are supplements, so they're not necessarily FDA regulated. So the amount of active ingredient within the formulation is anyone's bet. So we don't really know if you take 5 milligrams or 10 milligrams, which by the way is too much, are you actually getting 5 milligrams or 10 milligrams? I tell folks, sleep hygiene first. Melatonin, if you're going to use it, use smaller doses. Really, when we look at the data behind melatonin use, it works best when it's given to people who have jet lag. It works best when it's given to people who have shift workers, like disruption. It works really well in kids who are on the spectrum. There's actually, some compelling data that shows that kids with ASD or ADHD, autism spectrum disorder, or attention deficit do tend to have a more perceptible response to melatonin.
In my experience, also, people always think more is better.
I do think it comes down to the fact that when we say low dose versus high dose, again, we come back to that problem where it's regulated as a dietary supplement. So, it's less strict. So therefore, we don't really know what the pharmacological content is. But you're right. I do think that if you're going to get an effect, it's probably better at the lower doses. I think once you hit that 5 or 10, you're probably just exposing yourself to more side effects and not really getting as much benefit from it. So.
Well, let's switch to the harder stuff then. What's your approach towards prescription sleeping pills? Most commonly Ambien, trazodone, the categories.
Yeah, so there's a bunch of different medications there, and honestly, I think all of us in the medical field will kind of agree that probably more people than need to be are on sleeping pills in this day and age. I think the way I approach it, and a lot of people in the sleep medicine field kind of approach it, is there is a certain class of patients who need it at certain times. So, for example, if we look at, someone who's lost a spouse or gone or going through an acute grief reaction, I think the acute insomnia that comes with that is it is effective to use a sleeping aid, to use a sleeping pill to treat that acute insomnia. But I do think that using sleeping pills or sleep aids in lieu of, good sleep habits, instead of good sleep hygiene or cognitive behavioral therapy techniques, really probably not the way to go. I almost never start someone on a sleeping pill without going through certain basic principles of sleep hygiene, going through some basic cognitive behavioral therapy techniques. And there's good data to support that CBT, cognitive behavioral therapy, techniques and interventions are actually much more effective in the long run, especially instead of sleeping pills. And I think part of that is because our bodies get tolerant to medications over time, more so when they're this class of medications. So when you look at the different kinds of sleeping pills that are available, we have, the commonly used ones. So, you mentioned Benadryl, and I think you're right. I think a lot of people tend to reach out for Benadryl, thinking, okay, well, it makes me sleepy, right? But we have to remember that the FDA has approved Benadryl mainly for allergies and sneezing, and the side effect is sedation. And now here we are kind of reaching out for Benadryl in order to get the side effect, in order to actually get, we're using it for the side effect. And I think one of the big concerns I have about Benadryl as a sleep aid is that in older folks, it's actually very well known that that entire class, that whole anticholinergic class, is associated with fairly significant side effects. So confusion, we're not quite as clear about whether it's causation or association, but there is the risk of dementia with consistent and higher anticholinergic use. Again, we don't know if this is causation versus association, but it's seen. And I think using Benadryl on a long-term basis is really not a good idea. The other things that you can go to a sleep physician or your primary care physician to get would be, all the Z drugs, right? So the Zolpidem, the Lunesta, so as Zopiclone and Zalplon. So when you look at those are considered a little safer than, let's say, benzodiazepines, but they have fairly interesting side effects in some people. You've heard about people driving while asleep and, having sex while unconscious and things like that. It's a little rare, but it definitely gets a lot of press when you put that on a label. So I think those sleep behaviors that we see, that risk of side effects has to be something that's discussed, with whoever is taking that medication. So
yeah, and I think, we could go on and on. Obviously, there's a lot to consider. These are serious medications. I think a personal review of if you're taking a medication, why have you been taking it for 12 months? I mean, what's actually wrong? Is there an underlying issue that needs to be addressed? But
exactly,
to really be taken for a year.
Exactly.
During an acute stress or some other changes, I think supplements and sleeping pills are not a chronic solution, and that means something else is wrong that should be looked at either with a specialist like yourself or to really do some looking. The final thing is a lot of our colleagues work long or changing shifts overnight, intermittently. So does the same advice apply to them? You mentioned melatonin as maybe being a supplement that could be helpful, but other things like sleep environment, should they still aim for the 7 hours with the darkness, et cetera? What have you seen as helpful?
In my field, so when we talk about critical care as well, right? So you have intensivists who work night shifts, and especially with the pandemic situation that we've been having, those night shifts are becoming more stressful, and they're trying to go home and get those 7 hours of sleep. It's a little bit more challenging because remember that our body has a biological clock. We as humans are not designed to be sleeping during the daytime when there is light outside. I mean, that's just the way we are designed. But social obligations, work obligations, and those kind of take precedence. for a lot of us, and we are, if we are doing night shifts and things like that, we want to try and recreate as many good sleep habits as possible. I used to tell some of my nursing friends that when they're leaving night shift, wear dark glasses. So that way you've got your dark glasses on, you're not really looking at any light, you're walking towards your car, and you are trying to minimize the light exposure as much as possible. And I think trying to do those things should help. If you do have to work night shifts, or for that matter, if you have to toggle between night shift and day shifts, trying to group it to, let's say, a week at a time instead of going day, night, or day, night. If you can do 4 nights and then a week, I do think that's a little easier on your system. But again, the same thing, blackout curtains, avoiding light stimulation, going home, making sure the environment is quiet so that you can actually sleep.
So once again, prioritize sleep, accept the fact that you have to work some shifts. I mean, like as physicians, we all sign up for that at some point. It's the change from day to night that is very stressful. I know in my field in psychiatry, overnight work shifts, inconsistent with day shifts, is a big trigger for like bipolar disorder and other sort of major breakdowns mentally. So it is big stress that I think should be taken seriously and can be managed, but it is difficult, like you said. Well, thank you very much for your time today. That was very interesting points, and it's so great to hear from an expert about something that we may take for granted more than we should and need to take it more seriously. I think we all have some big take-homes from this discussion, and thank you once again for your time, and you have a lot to contribute to what's going on into our colleagues in the field. So thank you again.
Oh, thank you for having me.